Nisha, thank you so much for joining me today. I'm really happy we could talk.
Thanks. I am excited to be here. I really appreciate your time, Pamela.
So I just want to say, before we get started, welcome to the Renal Care 360 team. We are so happy to have you.
Thank you. Thank you. I'm excited to be here. I think the team is doing amazing work. I love the mission and the vision and the values of the organization. So I'm really honored to be here with you all.
And because you're new, could you just tell us a little bit about yourself?
Sure. So I currently live in Long Island in New York. I have two kids. My son is 9 years old and my daughter is 13 months. I have lived here for about 5 years. Prior to this, I have also lived in Boston, Massachusetts, and I grew up in Connecticut. My history, I have been working in healthcare for over 15 years now, and I love everything about healthcare. I love the fact that, every day I'm learning something new. Prior to my role here at RC360, I was at a number of healthcare systems, including New York Presbyterian Hospital, Texas Health Resources, and MGH. I also spent a bunch of time at CVS Health in their new product innovation department. And I was also working for an ophthalmology company, which I helped grow from the beginning into a large multi-state organization.
I would ask you this. There are a lot of companies out there that do kind of a similar thing that's in the same space as Renal Care 360. Could you help me understand from your perspective how we're different?
Sure. So I think the first and foremost thing that really attracted me to RC360 and what I truly believe is culture. Culture differentiates every company from each other, and RC360 is no exception to that. The culture within RC360 is completely focused on the patient. It is something that I have been so proud to really be a part of in the last couple of months as I've joined the organization. I think the other thing that's really important here within RC360 is the variety and the differentiation of industries and expertise that the organization brings together. You have a lot of people who have very deep expertise in healthcare and healthcare operations, but you have really sharp strategic minds. You have a lot of people who are focused on sort of the regulatory angle and seeing what's out there, but then of course, bringing this all back into focusing on the patient and what is best for the patient and how do you put together the best product for that patient.
So your title is Chief Administrative Officer. So what do you see as your main goals personally in this position with the company?
So I see my role here as Chief Administration Officer in really supporting Joe and the leadership team in providing a product to the patient that's on the cutting edge. So for example, we've been really focused on chronic care management for these patients in a very large healthcare system in Georgia. It's a rural area in Georgia where patients have been starved for healthcare really. And what CCM does, or chronic care management, is it provides basically a concierge service to these patients so that they are able to connect with a healthcare provider when and where they need it, which is very important as you think about a post-COVID world. These patients have diabetes, hypertension, renal disease, any chronic condition, you name it, and this patient population has it. And they really need sort of this very supportive assistance to get them through their days and make sure that they're living their healthiest and best lives. So one of the things that I'm excited about as in my role is bringing that not only to this population in Georgia where we started, but bringing that to many populations throughout the US that are going to be partnering with RC360.
I want to thank you for sitting with me and talking with me today. And I'm going to ask in the next couple of weeks, as we see more impact to our patients and we grow, I would love to sit down and kind of touch base with you and see where we are.